We're talking about, of course, Ebola. We have had the second patient in the United States. The first time it's been contracted within the United States. Of course, the second time it's been contracted outside of Africa, the other being a nurse as well. I thought it'd be interesting. We're going to go to your calls in just one moment. We're going to go to Dallas Ebola Watch. That's what the caller calls himself. But I wanted to talk about the first nurse that came to the United States with it that was brought in with Dr. Kent Brantley. Her name was Nancy Wrightball. This is an interview from Science Insider on October 2nd. They asked her, how did you become infected? Because we're told that all the protocols were followed. We're told that by the people who are in the hospital. Of course, the CDC is saying, well, you didn't follow one of our protocols. While they stand down at the border, they refuse to close the border. You know, isolation is the first protocol that should be followed. But going back to Nancy Wrightball, she says, I don't really know. She says, nobody's sure, least of all me. I never felt like I was unsafe. I never felt like I walked into a situation where I was being exposed. I was on the low-risk side of things. I was never in the crisis or the Ebola center. I was always on the outside. I made sure doctors and nurses were dressed properly before they went in and out. I decontaminated them before they went out. We kept a close check on each other. She says, we had an employee, though, who was doing the same job I was doing. He got sick. I didn't know he was sick. He didn't tell anybody. He actually thought he had typhoid. The day I started having symptoms, at least a fever, was the last day I saw him. He did have Ebola. He did not survive. She says, I never remembered touching him, although it's possible he could have picked up a sprayer to decontaminate someone, and I could have picked up that sprayer, or we could have touched the same thing. I never touched him. I never touched him. So she thinks that perhaps it was something that they touched intermediately, that he touched something, she later touched it. That brings to mind the reckless behavior that Judge Jenkins in Dallas modeled for everybody when he went to the apartment and said, there is zero risk that I can get it here because I'm not touching a patient. You don't have to touch a patient to get it. And, of course, she was on the outside of the Ebola Crisis Center. Of course, Dr. Kent Brantley, who was working there, also contracted it. I don't know what he thinks was the means of his getting infected. But listen, at the time that Judge Jenkins went in, it was several days after the patient had left. I would not feel confident going into that apartment. And, of course, the people who cleaned it up 2 days later, went another level above the hazmat suits that CDC had prescribed. But to go into that apartment and then to brag at a press conference that he's wearing the same shirt that he wore into the apartment and hung out with them in the apartment and then drove them in his car for 45 minutes, and he comes to a press conference and says, I'm wearing the same shirt, no problem. He is sending a very reckless and dangerous message to people, something that whether he intends it to or not, he does work for Homeland Security, so whether or not he intends this, he is sending a message to people that could very well spread this. The virus lasts, they say, anywhere from a few hours to a few days, and it also is dependent on the amount of sunlight that it gets. And we're going to have a report about that as well, another device that somebody has come up that may offer some promise on that. But the bottom line is, he didn't tell people that. He just basically said, there's no problem walking into the apartment if the patient is not there. That's not what somebody who worked in the country believes. Let's go to some of your calls now. Dallas Ebola Watch in Texas. You've been holding for a while. Go ahead.
Mr. Knight, thank you. I wanted to break some news that I haven't seen in the media, and it's regarding the pharmaceutical companies that have been contracted by the Department of Defense under Project Biohazard. Technira Pharmaceuticals, on their website, they have information that in January 14, 2014, they began human Ebola clinical trials. So clinical trials of their product, TKM Ebola, in humans. And
yes.
That was 2 months, obviously, before the outbreak.
Yes.
Technira is one of the companies that saw a 23% increase in their stocks. And they're... I guess basically because they're one of the companies listed as trying to find the treatment for this spontaneous outbreak. And
yes, very much.
Actually listed. Go ahead.
Yes, we're going to have a report on that in the next hour, actually. They not only began trials in January, but they also got a lot of money from Monsanto at that time, and they got a stock option, and that stock spiked 12 days before the Ebola outbreak in Guinea, the very first place that occurred this time, was noticed. So there's some very interesting follow-the-money issues going on here. There's also an interesting contrast and hypocrisy, the way that they're pushing ZMapp as a panacea, as a miracle drug. It works on an antibody strategy. And yet at the same time, these blood transfusions, which operate on the same antibody strategy, are demonized as a black market that needs to be shut down. I think there's a lot of questions that need to be raised about what's going on with big pharmaceutical companies and the government. I'm very concerned that they're going to pronounce one of these as a miracle drug and coerce everybody into taking it.
Yes, sir. Am I still on air? I'm sorry.
Sorry, what was that?
Oh, I was just wondering if I was still on air.
Yes, you are. Go ahead.
So I'm awesome. I'm so glad to hear that you guys are looking into it. I would expect nothing less from InfoWars. Dallas Ebola Watch is just a small little Facebook page that we started because we were concerned and we were following and researching these things. So Techmira Pharmaceuticals, look it up. Everyone, they're making money off this. The DoD contracted them to develop. And it's from the Zaire strain, which is odd. Another quick point is that on the CDC website, this outbreak is very, very odd because all of the CDC has a chronological history of the Ebola virus, and every previous outbreak started in one country. This is the only outbreak that started in multiple countries, and the nature of viruses, that's almost impossible. I'm not an expert, but I'm a critical thinker.
Yes.
That's ridiculous. How could it start at the same time in different countries?
There's a lot of questions about.
They were doing a trial.
There's a lot of questions about the timing of this. Let me ask you before I go to the next caller. You're there in Dallas. You're watching this develop. How do you feel about Judge Jenkins and what he's been doing?
Oh, my gosh. He's either complicit in this or he's just a puppet who's trying to politically posture himself for some further political aspirations. But I think he's an idiot.
My take on it exactly. I don't think we could put a finer point on it. Thank you so much. Let's go to Richard in Texas. Richard?
Hey, yeah, this is always a great show. I've been a Sunday afternoon listener for probably 4 or 5 years. And, I consider myself a constitutionalist, and I always say that the cream of the truth rises to the top, and Alex and InfoWars are a great example of that. I do have 2 quick inquiries about the Ebola. And find it very interesting that even though maybe it has not gone airborne, that it is indeed much more highly infectious than we've been led to believe, and that the World Health Organization seems to have more intense restriction on this than even our own Centers for Disease Control. And with that, I'll leave that to you. I'll just hang up and listen, but thank you so much for taking the call.
Well, I agree. I think that when you've got a disease that is doubling every couple of weeks, that they're looking at if it keeps up the same curve, that it's going to affect anywhere from 5 to 15% of the population in those 2 countries. I think that there's clearly something about it that they don't understand. It's not just the sanitation conditions in those countries or the lack of medical care. Look at the hundreds. It's well over 300 medical workers who have gone who are using all the protocols and procedures that are recommended as far as the conventional wisdom goes. I just read at the beginning of this segment, Nancy Wrightball, who is a nurse there, saying she had no idea how she got that. Her best guess is that she touched something that a fellow coworker who came down with Ebola had touched. That was the best guess that she could come up with. So there are ways that this is being transmitted that they don't really know because they're not controlling it even within their hospitals, even within their medical care workers.
In the past decade, we have witnessed unparalleled scientific discoveries in the area of health. But no one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. DNA Force is one of the most expensive formulas to produce. Some of the ingredients in DNA Force are $12,000 a kilogram. We are using the coveted, patented, only American source of PQQ, CoQ10, and more. You want the best that's out there at the lowest price anywhere? Well, we're bringing you a total win-win. The ultimate value, cutting-edge, trailblazing game changer that also supports the InfoWar. We have produced a limited run of DNA Force, and it will take up to 12 weeks to produce more once we sell out. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force from InfoWars Life.
Welcome back to the Alex Jones Show. I'm David Knight, and we are taking your calls about the recent developments in Ebola. As we were just talking about the patient who was a nurse treating the Ebola patient, Thomas Duncan in Dallas, has now come down with it, and they say that she was following all the protocols. They say she had protective clothing. The CDC is insisting that her protocol wasn't followed, and yet we see people who have gone to Africa by the hundreds dying from Ebola. Medical workers, doctors, unsure how they contracted this disease. They were following the protocols. I'm sure if you go to that country and you see if you've seen the pictures of people who have Ebola, the horrific blisters and just the condition that they're in, if you watch somebody that has contracted that, if you're treating those people, I would think you would use the utmost care to try to make sure that you don't contract that. I don't think people would treat it in the cavalier manner that we've seen Judge Jenkins illustrate in Dallas. I think they would be very much more concerned, very much more careful about this if they had actually treated people who came down with this. So my take on this from the beginning is that they are not telling us the truth about how it is transmitted, or they don't understand it. We have seen a lot of doctors come out and say that they believe that the protocol that you can only get it if you come in direct contact with someone who is currently exhibiting symptoms. We've seen a lot of doctors pushing back on that now, saying they don't believe that is true any longer. I think it's time for us to reassess that. I wanted to take some calls from people, especially people who were medical professionals. The next person on the line is William from Tennessee. He says he's a worldwide eye care provider. William, what does that mean?
Hi, how you doing?
Hi. What does that mean that you're a worldwide eye care provider?
Well, I do medical mission work all over the place. I done Africa, Haiti, South America, all over.
Okay. And what did you want to say about the Ebola outbreak?
Okay. Well, what I want to say basically is, like, when I go to some of these countries, I see a lot of people, dying from stuff that's so simply conquered here that it's not funny. I mean, that's just something that happens. Means that their healthcare system is just not up to par at all, for one. Now, to let the stuff come here is kind of stupid, because a lot of the countries do not even let me enter unless I have certain vaccinations.
Yeah, it was interesting to see that as these Marines were touching down in Ebola, it was Liberian doctors who came out and took their temperature. We don't see that happening anywhere in the United States. Right.
Now, I mean, I'm one of the ones who was in Florida during those hurricanes. And I've seen the fights for gas and stuff like that. And that judge that walked in that house is an idiot. I hate to say that, but
yeah, it was very reckless. That was very reckless behavior. I don't know if. Listen, he's got an agenda. This is a guy cut his teeth on open borders, and that's his agenda. He's up for re-election in a couple of weeks. People in Dallas need to take note of this. But absolutely, what he did was recklessly modeling behavior that nobody should be that cavalier about with this disease, Ebola.
Yes. Now, for sure, I was a first responder in Haiti during those earthquakes, and I was right there when the press was lying, or CNN was lying to the public, and they actually had to recant what they said, because the Dr. Sanjay Gupta said, they're making all those first responders leave for security concerns, and we was just getting on the buses, getting our equipment off. And we was like, what? And
no, you're kidding me. CNN was actually caught lying? Can't believe it. No, we've seen, I don't know if you've seen it at InfoWars, and we show it often, that clip where at the outbreak of the first Gulf War, they were actually in the studio and they were putting on gas masks and helmets and pretending that they were under missile attack. I mean, it's a pretty funny clip, but they're running it now for anybody that's watching this. But yeah, we've caught CNN stretching the truth and fabricating the news quite a number of times, so I'm not surprised they did it. It's interesting to hear you give us yet another data point.
Well, get ready. That's all I got to say.
Yes. Well, thank you so much. Let's go to Jerry in Georgia. Jerry.
Hi, David. I just wanted people to think that I want to point out that the soldiers being sent over to Africa, they're nothing more than a mandatory control group for a clinical trial.
I believe so. I believe so. We've seen that happen many times, haven't we, with the U.S. military? They've used them as guinea pigs.
Yes, sir. Alex has documented many times, but also when I was sent overseas to Panama, you're given all kinds of inoculations. You don't know what you're given.
Yeah, absolutely. Well, they just did it. They just did a major exercise where at Camp Lejeune, they said, well, we're going to run a drill that's going to be in case a pandemic breaks out. And they gave 1,200 flu shots, they said, to people. And you see the picture of it. The guy's not wearing gloves that's giving the flu shots. But they gave them 1,200 shots. They said it was a flu vaccine. We don't know what it was, right? And we also don't know when you get a flu vaccine. That's one of the things we talk about here at InfoWars over and over again. What is in the vaccine? What are the preservatives? What are the things that they use to accelerate it? Well, of course, it's things like mercury. It's things like formaldehyde. They're clear about that. They put all kinds of stuff in there. So apart from the whole idea as to whether or not vaccines work, and we're going to have a report, I'm going to talk about some information that we have about this miracle drug, ZMapp, and we're going to take a look at the history of how pharmaceutical companies have been getting into this particular outbreak. It's very interesting, the timing, and it's very interesting, the hypocrisy of how they're selling something that is essentially based on the idea that you're going to give somebody's immune system a boost with antibodies, but instead of doing it with blood serum, they want to do it with an artificial, genetically modified plantibodies. And of course, that's where they're putting all their money. DARPA started it. DARPA helped to fund it. Big Tobacco helped to fund it. The Gates Foundation is getting into it. So we're going to talk about that at 6 after. But I want to take your calls in this segment and in the next segment. Thank you, Jerry. Let's go to Alan in Florida. Alan.
Hi, David.
Hi.
2 points. Remember when they brought in the infected doctor and the nurse who was with Samaritan's Purse?
Yes.
And they brought them to Emory University. The contractor on that was Phoenix Air out of Cartersville, Georgia, which is an interesting airline. If you look up, they have a State Department contract to be transporting the Ebola patients. And they've also done a lot of work in the intelligence community.
Yeah.
The second thing I want to mention was there was rumors, I'm going to say these are rumors because I have no evidence, on the internet back in August that there was something going on in Kenema, Sierra Leone. The rumor was that there was some sort of laboratory at a hospital and that they may have been involved in this Ebola outbreak, and that someone named Glenn Thomas with the World Health Organization was going to try to blow the whistle on a cover-up there, and then he was killed in the MH17 crash. Have you heard any of this? This has been debunked supposedly by PolitiFact, but is there anything to be looked at there?
Well, I'm not sure. I mean, there was a report that was picked up. We picked it up by John Rappaport. It was also picked up in one of those countries talking about how they had shut down a medical research lab there that was working on Ebola that they were concerned about. So I'm not prepared to talk about that at the moment. And, you know, people can do their own research on that.
Okay. Well,
thank you. Yeah. In terms of talking about contractors, though, as well, people have pointed out that if they wanted to build these facilities, they have contractors that they could send over. They don't need to send over thousands of troops. I really do believe that they are being used as guinea pigs, that they're being used to expose them and then, of course, bring that back. But don't worry, they've got your back. We've got Obamacare. We've got the VA. You know, they've been there for us every time we need them, right? We're hearing that from Lori Garrett, who is a writer. She works for the Council on Foreign Relations, and, you know, she came out last week and said, hey, Obamacare is the way that we're going to keep track of this. That's key to controlling the Ebola outbreak is going to be Obamacare. I would say if that's true, it's game over, man. We're done. Let's go to Ginger in Florida. Ginger. Hello, Ginger. Are you there? I think we lost Ginger. Let's go to Shauna in Kentucky. Shauna.
Hey, how's it going?
Doing good. How are you? What did you want to talk about?
Good. So, my background's psychology, so I wanted to give you a little bit of a background on these killers, because that's what they are. And, you know, it really goes back to 1776. I called and spoke to Alex about this little baby code, and I just want to let people know, because they might not understand this. But the year 1776, we have 2 sevens in the middle, the 6 on the end, the 1 on the end, that's another 7, that's 3 sevens. And the way the code works is back then, they wrote these 7s like they had a little end on them at the bottom. When you flip it, they look like 2s.
Do you understand how dark it is? How far down the line we are? How late it is?
Welcome back to the Alex Jones Show. I'm David Knight, and we're taking your calls here. Of course, this is the day that we've learned that a second person in Dallas has come down with Ebola, the first person in the United States to contract it in the United States, the second person to contract it outside of Africa. In both cases, they were nurses. In this particular case, they are very adamant that they followed all the procedures. They don't understand what's going on, but of course the CDC says you must not have followed our protocols. Well, you know what? People who are following their protocols are still coming down with the diseases in Africa. They don't have it under control there, so the question is, do they really have a full protocol? And the first protocol is you don't bring people into the country who have it. You don't allow that kind of travel into the country that we've seen. Of course, they are not going to do anything to control travel, to even screen people who have been traveling, because, of course, that would be politically incorrect. We need to keep our borders open. And this is the result of keeping our borders open. It opens us to terrorism, to disease, to financial ruin, because Obamacare, unlike what the lady from the Council on Foreign Relations told us, Obamacare is not going to solve Ebola. The two of those combined will destroy this country financially as well as by the millions of people dying if it gets out. But let's go to some of your calls now. Let's go to Darren in Texas. Darren, go ahead.
Hey, David.
Hey. What do you want to say?
Talk to you. Listen, I've got a couple of points here. First of all, I work in a hospital in North Texas, and you know, the equipment they're using is just protective equipment. It's a front gown with a face shield and a mask. It is not a hazmat suit.
Yes.
So we've got to be careful and distinguish between those two. Also, I want to know how much, what's the percentage of healthcare workers that are from Africa? I know I work with a number of them, probably 60 or 70%, and they travel back and forth. And I just wonder if there's something with that as far as...
That's very concerning, isn't it? Because the lady who called in the ambulance for Mr. Duncan on that Sunday, the second time, he was reluctant to go back because he had just been sent away when he had gone previously. She worked in the healthcare industry, and when the ambulance workers got there, she told them, put on masks and gloves. He's from Liberia. There are viruses. She didn't mention Ebola, but she was concerned for them. And, she was given the all clear by the CDC only 1 week later to go back to work. She was caring for him as he was sick. I mean, she was somebody that they should be keeping isolated in quarantine, yet they gave her the all clear to go back to work. Yet to her, we're grateful that, to her credit, she did not do that. She isolated herself. I don't know if she is still doing that or not, but of course, giving her the all clear after just 7 days, it takes, from their literature, 8 to 10 days for it to manifest symptoms, up to 21 days. But after 7 days, they told her to go back. So again, we see this inconsistency with the CDC in terms of what they're telling people and what they're actually doing. That's very, very troubling. Do you find that troubling?
I really do. I find all of this troubling, to be honest. I mean, they're just totally disregarding all the protocols that we've followed for years now. And to bring them in, I mean, there's only so many level 4 beds in the U.S.
I think it's 19, yes.
Yeah, and it's just crazy to be dealing with these. I mean, it is so easy to make a mistake. I mean, when AIDS was a big problem, needle sticks, I mean, that's a lot harder to stick yourself than to rub your nose after you take off this protective equipment.
And as I mentioned before, the Nancy Wrightball, who came back with Dr. Kent Brantley, the first two that were brought into the country, she said she had no idea how she had contracted it. She said she was very careful. She was not even in the hot zone. They would decontaminate the doctors when they were coming out. The only thing that she could guess was that she had touched something that a fellow worker who came down with Ebola had touched, and that had transferred that way. She was certain that she had not had any direct contact with him, had not touched him. That's what we're told is the only thing that we need to be concerned about. Yet, she knows that she did not do that.
Now you can watch The Alex Jones Show live as it happens at Infowars.com/show.
You'll find links to all of our content there and a free 15-day trial for Prison Planet TV.
More than 60 movies and documentaries all in one place at Infowars.com/show.